Hello everyone, I'm Dr. Santoshi Nandigam, Consultant Obstetrician and Gynecologist, Cadence Hospitals, Kodambakkam, Chennai. Welcome to my YouTube channel. Here are my 5 tips to identify and differentiate false labor from a true labor. If you have watched my previous videos, you would have got an understanding about how to define your pain in pregnancy. So I would have mentioned about location of the pain, the nature of the pain, frequency of the pain, the duration of the pain, associated symptoms, uterine tightness, and all of these. So why did I tell you to define your pain is because we use these criteria to differentiate between a false labor and a true labor. It is very common for the first-time mothers to drop in at the hospital with the first pain that they encounter. I'm not saying it's wrong. It's right. Whatever you feel is right is always right, especially when you're pregnant and when you're about to deliver. But if you can identify these symptoms and if you can differentiate between a false labor and true labor, then there's nothing like it. You're very relaxed, you're very prepared, you know what to do, you know what are the signs of true labor, and you know when to exactly walk into a hospital. So my 5 tips to identify false labor. Number 1, false labor pains do not progress. They do not progress in intensity, they do not progress in duration, they do not progress in frequency. Let's say or 5 o'clock or a contraction vanduchu, 5 a.m. in the morning a contraction vanduchu. Then the rest of the day you're quite comfortable. Probably you'll have another contraction at around 6 p.m. and then another contraction at around 10 p.m. and then you're able to sleep through the night. That is not a progressive labor, or that is not true labor. If your baby movements are good, if there is no associated bleeding or no associated uterine tightness, you don't have to worry about it. Number 2. So when you have a pain which is going away with certain activities, for example, you take a nice hot water bath, you take a good cup of hot coffee, or you take a good cup of kashayam, parents and in-laws do give some kashayams to reduce the pain and all, and if it's working out for you, then it's definitely not true labor. It's definitely false labor. Number 3, there is no specific location to the pain. It just hurts. For some women, it can hurt in the lower abdomen. For some women, it can hurt in the upper abdomen. For some women, it can hurt in the lower back. For some women, it can hurt in the legs. For some women, it can be like menstrual cramps. There is no specific location which you can point to, which is hurting, which is more the quality of a true labor pain. Number 4, sometimes women have a uterine tightness without any associated pain. That's called as Braxton Hicks contractions. That is, your uterus becomes a little tight, but you don't perceive any pain. It is quite common towards in the 3rd trimester, towards the end of delivery as well. So if you notice some kind of uterine tightness without any pain, just wait and watch. It doesn't mean you should never come back to the hospital or you should never call your gynecologist. Please call if you have any doubts. Please get it clarified and please come and drop by in the hospital if you're not confident at home. 5th, so if you're able to forget the fact that you had a contraction before in some part of the day, it definitely doesn't mean labor. It's mostly a false labor, or it's mostly a latent phase of labor, which is just trying to prepare your body for what is to come in the future. So if you're able to sleep in between those small sweet pains, it is most definitely false labor. Thank you.